Be going through how to use the Confident Clinician to save at least 5 hours a week out of your workload. I deeply understand what it feels like to be a busy clinician or a budding clinician who is working towards being busier, and how impactful 1 to 2 to 5 hours a week of lost time can be towards you achieving what your actual goals are. So for many of us, we are small business owners. We need to drive new patient growth into our practice, or we have young families and we want to get home in time for dinner, or we just like to shut our laptops occasionally and not have to work too late into the evening. And really, in my opinion, the backlog of work and this time suck of being a healthcare provider, especially for naturopathic doctors, actually affects our ability to show up as our biggest, brightest selves. It affects our ability to meet our goals, whether those are impact goals or maybe income goals or just life goals. We are stunted in our growth as a profession because we don't have access to the same resources that every other healthcare professional has access to. And so I would love to be able to show you what life can look like on the other side of that, when you are supported in your work with something that can help you with your time. So if we haven't met, I am Jordan Robertson. I am a naturopathic doctor. I am the owner and founder of the Confident Clinician. This is a picture from our retreat from a couple of weeks ago. If you follow me on social media, you know I love to support clinicians in lots of different ways, from leadership training to business training to clinical training to just how to be able to show up without being burned out in our work style training. And outside of my life as a naturopathic doctor, I am a parent. I live on a hobby farm with my husband. I'm a mediocre weightlifter, mediocre master's weightlifter. And most of those passions, hobbies, other things we'll call them, are only possible because when I was a clinician, I created time, space, and capability for myself through systems. And some of those systems I'm going to show you today. And many of those systems became what was the eventual evolution of the Confident Clinician. So my first question for us in the chat is, how many hours do you spend? We'll think about this in terms of weeks, right? We'll think about it in terms of weeks. I know when I was a practicing clinician, I really could only think about my life in terms of like every day, right? My husband would be like, "What do you have tomorrow?" And I'd be like, "I don't know. That's tomorrow's problem. That's not today's problem." So let's think in terms of a week. I would love to hear in the chat, how many hours a week do you spend charting? Now, I just did a presentation for 400 doctors with another organization, and I asked them what was their biggest pain point in their life, and it was charting. So no one can tell me they spend 0 hours a week charting at this point. I would love to see in the chat how many hours you spend charting per week. I know when I was a practitioner, I worked very hard to get my charts done in the visits, and have lots of suggestions and systems for how to do that. And again, we've built TCC so that it actually is able to help you finish your charts in the visits. But I would love to know from those of you that are in the audience, or maybe you can just think about this, how many hours a week am I spending charting? How many hours a week am I spending marketing my practice? And sometimes when we go to answer that question, people will say, well, I'm only spending an hour, but I really should be spending 5. That's a really important reflection point, actually, because if things need more time and you don't have time to give them, I think that's just as important of a reflection as spending a lot of time on it, right? And how many hours a week do you spend, I'm going to say, in communication with other healthcare providers, maybe even people in your own office, where you need to communicate what's going on with a patient to someone else, right? And if we add up all of those things, it usually means you're late for dinner, you're working on weekends, you're trying to cram some things in before your kids wake up in the morning, you're sending patients their treatment plan a couple days late, you're not getting those faxes sent on time, right? It probably means a few things based on the number of hours required to meet your goals. And maybe you are fitting in all of that paperwork, but then struggle to find the balance or the joy because many of those tasks are actually pretty passionless tasks. When we get through all of those things and we go home, and maybe we even go home in time for dinner, we're maybe not our best self because we've spent the majority of the day doing, I call them passionless tasks. So to the untrained eye, this might look like an awesome day, right? You're like nice, busy Thursday. If you ask, your friends or your partner or your parents what they thought about this little schedule here, they might think this looks like a pretty easygoing day. You've maybe got lunch in there somewhere. You have a little break in here, looks awesome. But to a clinician, when we see this day, we're seeing it through a very different lens, right? You're actually seeing it like this, right? And acknowledging and recognizing that each of those blocks of time have a task or many tasks associated with it that need to be completed in order for you to even have done the bare minimum work for that appointment block. Or, and most of us are not trying to do the bare minimum, we want to show up as the best clinician possible in that appointment block. And yet it's hard to do when they're stacked like that, back to back to back. And yet, if I go back over here, this looks like a dream, right? But it's the unseen and the accumulation of work that's happening behind the scenes. And so this is not an atypical scenario, right? Where we have a new patient, but there's something that they have that you have not looked up in a while, right? Maybe they are a menopause patient, but they also have asthma. Maybe they're a digestive patient, but they also have asthma. This is one of the challenges with niche-based practice is that you get really darn good at one thing, but everybody still has other things. And now you've got to look something up, right? We call it a reactivation if patients haven't been seen in 6 months, but maybe you haven't seen this patient in 2 years and they've listed on their form that they have something new to talk to you about, or maybe you actually just haven't even looked up what they came in with before, and now you have to re-look it up again, right? I always have this reminder in my mind. I had this one patient who had pancreatitis and it wouldn't bother him all the time, but then when I saw him on my roster, I'd be like, oh gosh, I got to look up the pancreatitis stuff again because here he is, right? And he was such a lovely patient, but would only come out of the woodwork every couple of years, right? Sometimes patients have a very easy or what feels like a very easy follow-up, but now they need a letter because something's outside your scope, or you need to recruit the support of someone else in their health team. And now we have paperwork associated with just delivering great care for our patient. Maybe patients need a prescription refill. And I don't know about you, but when I knew patients just needed a refill and we're just going to chit chat about their summer plans, that felt like a holiday in my day. But if they come in and they're having concerns or they're not better, right? We always just hope we can refill, have a great chat about their behavior change and compliance, and then they can be on their way and we click close, right? And the chart is done. A new patient for your niche, again, whew, like phew, right? I always feel that way. When patients came in with PMS, I'm like, all right, this like, hold my coffee. This is an easy one. Maybe you have a new patient that's outside your niche, right? Completely. We often end up treating the friends and family of our current patients. And sometimes that means you're needing to stretch your knowledge or get caught up on new knowledge just to see that new patient that you agreed to see. It's rare that practices are so niche that they're going to turn away everybody else. And even when we do that, and I was a menopause practitioner, but I treated a lot of high cholesterol in partners in my years because I always wanted to treat the family if I had the opportunity to. Maybe you have a follow-up on your list and that person actually isn't improving, right? And those to me were always the hardest appointments to prepare for. You hoped they were getting better, but what if they weren't? What was going to be your contingency plan if nothing had changed for them? And so now we need to figure out or dive into the research and figure out what we're going to do with them because our plan A didn't work for them, right? So the way that I see it is that it's going to be impossible for us as a profession to have the impact we want to have, right? Reach the stages we want to speak on, to have the expertise and authority we want to have, or the life we want to have. This is our retreat picture from Costa Rica. It was a very cloudy day and we could not see the volcano that's behind us, but apparently there is a volcano back there. You can't have the life you want to lead when you're stuck under passionless tasks at work, nor can you grow your practice to the point where it provides you with the life you want. So now we're stuck without impact. We're stuck without the life we want. No wonder patients, practitioners turn into patients essentially with burnout because the setup and the very system is really not designed to support you. So with the problem that we face, and we're going to talk about these time management supports and how to use TCC to absolve you of all of these challenges, is that the problem is partly in creating protocols, staying up to date, looking something up if you haven't seen it in a while, being able to support a family member or a friend that's outside your niche, or to be able to look up secondary options, right? Maybe from memory, you know what to do first crack for psoriasis, but when that treatment plan fails or it only receives a partial response, maybe you need support to figure out what does a secondary treatment plan look like for this person. So the feature that I want to highlight within Confident Clinician is our one-click patient protocols. And so in 6 seconds or less, you can have the answer to all of those things. You can use our smart search bar to actually ask, can you write me a protocol for fill in the blank, right? So if it was asthma, arthritis, pancreatitis, right? Thinking about my patient, whatever it is that maybe you don't see every day, but should be part of your primary care arsenal, you're able to look it up, including the plan, the dose, the expected outcomes that you want to have, which I'm going to show you an example of that. That's always one of the most important things to share with your patient is like, what do we expect to happen when I prescribe this? But our smart search listens to all of our content. It listens to all of our dialogue. So it's able to have a conversation with you about your patient's treatment plan and is able to give you suggestions based on our knowledge base and the research that we have done on your behalf. We also have a very sort of standard database approach where you can read about every topic as well. So every medical topic has an at-a-glance section where you can actually read what your role is as an integrative or naturopathic doctor, how to support your patient, how to assess your patient, what medications, what supplements, what exercise, behavior change, nutrition, and any other ancillary supports that have evidence are showcased on this at-a-glance page. So if you need to get up to date really quickly on a topic, if you need to get support or see the list of all of the supplements, you can use either resource to help you get caught up in the moment. So if we go back to our Thursday, which was looking like a bit of a slog, you can see that we can actually look up very easily what to do for asthma. You use the at-a-glance section to look up the latest labs, nutrition recommendations, and supplements before the patient even walks in the door. So now you're not only prepared, but you'll be able to complete the appointment in the time allotted for that patient without saying, I'll get back to you, I'll send you your requisition later, right? I'll look this up. I'll look it up is like the kiss of death after an appointment because it means that you are actually giving yourself homework that I would like to see you accomplish inside the visit with the patient. That's only possible if you have a resource that actually supports you in doing that. Here's your patient we haven't seen in a couple years. So let's use the AI to see if there's anything new that's been published on the topic. Can you tell me anything new about pancreatitis so that I can stay up to date for my patient who I haven't seen in 2 years? right? If your patient's coming in about a topic that you are not well versed at or you don't typically treat, you can ask it to create you a treatment protocol for your patient, and it will give you everything you need to execute in less than 6 seconds. Whether that's a list of labs you need to run, whether that's the physical exam you need to do, whether that's the nutrition plan, you can ask for all of those pieces and build the treatment plan during the patient appointment without an ounce of homework. When a patient's not improving, you can actually ask our smart search bar what else you should consider. You can even say to it, what might I be forgetting when I treat my patient with arthritis? And it will help you work through a thought process that allows you to quickly create a secondary treatment plan for a patient who maybe has underperformed with the first prescription. It can also help highlight some areas that are sometimes overlooked because we want you to be able to be the best practitioner possible by giving you access to all of those resources. So our examples here, and I took screenshots right from our system to show you what it looks like. Here's the at a glance for asthma for our first new patient there. Here's the question, is there anything new on pancreatitis? And it actually gives you an update on how the literature has shifted for supporting patients with pancreatitis over time. So if you haven't looked at it in the last 2 years, now you're suddenly perfectly up to date, including the references back to the main materials. We can ask questions about treatment plans and how effective the treatment plan will be. So this was an exceptional follow-up question I asked here. What's the magnitude of benefit? And it actually told me what to expect. So if you're feeling like your treatment plans aren't landing or they're not effective, we can actually ask about magnitude of effect, and it will share with you what to expect when you prescribe what you've prescribed. We also asked what to consider if my treatment plan for acne isn't working. That's what I chose. And it gave examples of how to think through the case. Ask the patient how consistent they've been. Ask about other factors. Think about doses, right? It's actually helping you work through a thought process. And really, when we think about knowledge base or we think about access to resources, we don't need a summary of what to prescribe. We actually need a framework for how to deliver medicine and the medicine that we do. And this is really what we've built at Confident Clinician. We're not going to give you, bullet points on all the supplements for acne. We're going to give you a framework for how to prescribe it so that not only do you have the knowledge, but you also have the way to have it implemented to get the best outcomes. So we're back at our Thursday here, and our great patient here needs a referral for a sleep study. It really highlights one of our other pain points, which is paperwork, our passionless tasks as a healthcare provider. And the feature that I want to highlight here that makes the biggest difference and will save you the greatest amount of time is our one-click letters and one-click resources for your patient. So you can ask your patient to draft letters for you. It will give you examples. It will highlight everything that you need to include. So not only is this a great way to build your letters, it's also great reminders on how you should be performing assessment in your patient. So it's reminding us that we should do a stop-BAM questionnaire with our patient here. It's suggesting that we, include any other relevant factors so that the referral is successful. And it's also, you're able to copy it and paste it with your letterhead and include it in your chart for your patient with one click. So it's really saving you some of that, I always call it unpaid labor as being a healthcare practitioner, where you want to tie a beautiful bow on your patient case, but it's requiring you to do additional tasks. At this point, you can use technology to do this faster for you. And that's really how we're going to gain you some time back each week, is by using technology and trustworthy technology to do tasks that you have had to do on your own very slowly and inefficiently up until this point. So as healthcare providers who practice naturopathic or integrative medicine, we have a bonus problem. I call it the bonus problem, right? In terms of what it's like to be a healthcare practitioner in our field, is that our Thursday isn't just a Thursday of seeing patients, but it's also a Thursday of being a business owner. And so between every patient, and this is how I used to try and keep up with my social media, is I would use every spare minute to try and grow my practice while I was also seeing patients. And so I know that for many of you, you are trying to grow your business between every square minute of time, right? And so even though these look like breaks, right, they're really not. And we really all wear these proverbial roller skates when we're at work, trying to frantically see the patients we have while trying to frantically find new patients that we don't yet have. So the feature I want to highlight here is that our smart search will actually turn every research question you ask into patient-facing materials, specifically patient-facing marketing materials. So you can ask it to turn your questions into something shareable so that you can promote your practice with one click. It easily creates captions and lets you pick the photo to go with them. I gave an example here of gout. And I also want to show the source page. And so when you're sharing this information on Facebook or on LinkedIn, you can actually include the resource page that goes along with it to show that you're a member of a trustworthy source, that you practice with the best evidence-based practice materials that exist for naturopathic doctors. And it's written the caption for you. So you have the ability to one-click promote your practice. Every time you have to look something up for a patient, you should be using this as an opportunity to share your knowledge online. And we've made a streamlined way for you to be able to do that, saving you even more time per week. So I'm guessing, right, up until this point, you can probably see how we would save you 5 hours per week, right? Like that example we gave of a new patient with something you've never seen, a patient who's coming back in and they're not better and now you don't know what to do, a patient who needs a letter, a patient who needs a handout, right? A patient who you haven't seen in 2 years and still has pancreatitis and only comes when it flares up, right? But really, when we talk about building effective and long-term systems, and this, whenever I talk about this, I know that the immediate reaction is to say, I don't have time for this, Jordan. Okay, so I just showed you how to save 5 hours a week. That should feel like an absolute no-brainer, right? The smart search, the at a glance, the letter builder, all of those things, that gives you 5 hours, no problem, right? And it's an absolute no-brainer for your practice. I want more for us, right? And when I think about what really supports us in practice, what really takes us to the next step is actually being part of a community that saves you from taking days off work because of burnout, that allows you to practice at capacity. We ran a really, really comprehensive survey last fall, and we had patients or practitioners who were burned out, and we had practitioners who were not burned out. It was an economic report survey. The practitioners who were not burned out worked 20 hours a week. The practitioners who were burned out worked 19. So the difference in burnout has nothing to do with the number of hours you work. It's about how you feel during those hours. And we know that being part of progressive personal development reduces burnout. We know helping clinicians see a path forward in their career helps prevent burnout. And we know that handing clinicians access to each other and to mentorship reduces burnout. So the real time saver in naturopathic medicine is the solution that keeps you at work, the solution that keeps you happy, that keeps you thriving, that keeps you connected, that keeps you from quitting, right? We had a member reach out yesterday saying, I literally was going to quit the profession until I got this membership. Thank you. So the real time saver is actually addressing the problem of lack of mentorship and community. We've never had this opportunity where we can connect with clinicians on a daily basis, on a weekly basis, on a monthly basis that agree with our style of practice and evidence-based medicine, that are vulnerable and open and willing to share. And never have we been able to access the level of mentorship that we've baked into even our basic level of membership at the Confident Clinician. So first off, every topic we deliver is delivered live, which is very different than other databases, right? And if I belong to every medical database that's out there, there are a lot of words. There are not a lot of people. And I wanted to do something different. I wanted to give people the opportunity to watch content be delivered live by their peers, but also to be able to dialogue with those peers and ask questions and get a deeper understanding. My background is in effective adult education and inquiry-based learning. I've spent 15 years teaching at McMaster University. How do we train young clinicians and pre-clinicians to be lifelong adult learners with great critical thinking? And part of it comes through live peer-to-peer delivery of content. And that's why we do it that way. And so we offer live calls, we offer office hours, we offer intensives that are done and delivered live so that you have the ability to actually grow as a person and as a clinician with your peers. And I know as soon as I say there's live calls, people say, I don't have time for live calls. What time are the live calls? I have patients during the live calls. You have to trust me on this one, that the real lifelong time saver in your work is feeling a sense of belonging. The real time saver in your work is understanding something at a level and a depth that you don't have to look it up for a year. And if you want that level of time saving support, connecting at this level with those clinicians is going to make you feel the biggest difference in your practice. Yes, we can give you answers in less than 6 seconds. I want you to feel more connected to your profession than that and more connected to your peers than that. So our smart search bar listens to all of our dialogue. And so it's like you're chatting with a friend, right? If you're old enough to remember the phone a friend on Who Wants to Be a Millionaire. I always love that reference because that's what it feels like. You're phoning 800 friends when you have a question. But really the magic is in our community, and the way that we build our content is with you in mind, right? We build it, even though it's delivered at scale, it's delivered at scale in a way that has created such warmth and community that all of our members absolutely love the live calls, even though the day they joined, they said they were too busy to go to them. So if you're on the fence, and hopefully by this point you can see, right? If we did the math, and we'll do the math for you in a second here on how you would get 5 hours back per week by implementing this system into your workflow. Most of our members keep the tab open, the AI tab and their general membership dashboard tab open at all times. We have more than 300 doctors log in every single day out of our 800 doctor membership. People use it every single day. We have more than 2,500 AI searches a week. People are asking a lot of questions and getting a lot of support for their patient care. But at our last live event that we run 2 live intensive events per year. Our next one is in the fall. And at that event, when I was gathering feedback for the event on how they felt about the speakers and the topics, I asked our members, what would you tell someone who was on the fence about joining Confident Clinician? And this is what they said. So some great, and I screenshotted them from each of their surveys. And so that's why they look like that. Best investment. So you can see the range of practitioners, and I hope that you can see yourself in these practitioners. Some of them have been in practice for a long time. Some of them are brand new. Some of them felt afraid and then jumped in anyways. Some of them love the way that it helps them kick off patient appointments with evidence-based information. Some of them are using it to accomplish their continuing education, right? Some of them think it's the best clinical investment they've ever made in their practice. Some of them think they've made their money back within the first week of joining. Some of them have really felt a renewed sense of community, connection, and purpose by being in the group because they can see how they're part of a bigger system of patient care, right? Some of them have identified or acknowledged that it gives them a safety net when they're in practice, that rather than feeling unsure and unconfident about prescriptions, they know that consensus-based prescribing, which is what we're doing here with TCC, is we're setting a standard of care and we're all doing the same thing. And imagine how that would feel sitting in a patient appointment, being able to say, I've basically run this by 1,000 of my colleagues, and this is what we do for this condition. The level of confidence and support that would feel like, right? We have clinicians who join at the moment they graduate from school or even before they leave school. We have clinicians join who don't feel competent at tech and they still manage to figure it out because we have a great onboarding game for you. So that's easy and implementable within the first day that you join. There are people there who feel really great about the community. There are solo practitioners who maybe have never made a live call, but still feel really connected to the work that we're doing. The best decision they've ever made. It's so helpful, saves a ton of time. The best decision they've ever made. Telling a friend, it's the best decision I've ever made for my practice. So I understand when you feel like you are stuck in a time suck, right? And I'm sure we've had patients who have that same experience where it's almost like they need to start doing the thing so they feel a little better, so then they have even more energy to do the thing. That's what it feels like to implement something new into your practice, right? You're like, I don't have time to learn how to do something new. I don't have time to change the way I practice. I don't have time to look stuff up. You don't not have time to do these things because they're the very things that are going to keep you in your job, keep you happy, and I would argue keep your patients because it lets you practice at a standard that we've never had access to as a profession before. So our premium membership gives you access to unlimited searches. And so this is something that is a huge value of ours. If you're a member, you have access to our content, 100% of it on the day you join, and you get unlimited searches every single day inside your membership. You also, as part of that, get unlimited captions and marketing creation. These two go hand in hand. You get access to our full knowledge base, which includes all the videos, all the at a glance, all of the research articles we've published, all the updates, all the office hours, all of the grand rounds we've done in the past. And so those big intensive courses that we've run are sitting there waiting for you to access them the day that you join. You get access to our community forum, the ability to come to all of our live calls. We didn't even get into how we support you from a business perspective. That's really a cherry on top at this point. I'm sure if I handed you back 5 hours, you'd feel miles ahead in terms of your business anyways. So how to join. My support person, Haley, is going to throw the link in the chat. And how you join TCC is by committing to supporting yourself for a year-long premium membership. It gives you access to all the content that's to come. Right. So this July, we're doing a deep dive on anxiety. This past week, we did a research refresher on libido and desire in patients. We are adding new content all the time. And when you join with that premium membership, you get access to everything we're creating for the next year that's coming, but also everything that we've created for the last 5 years since the day that we joined. So the link is in the chat there. And by completing that registration, you get access to everything on the first day. Like I said, a year of interactive learning, 360 support through marketing materials and more, as well as access to everything we talked about today. And I guarantee that we would save you 5 hours by the end of the week, even if you don't have enough patients in your calendar yet. And that's one of the biggest questions we get asked. What happens if I'm not busy yet? And the answer I have to that is if you're not where you want to be in your practice, you need to do something to get where you want to be in your practice. And the clinicians that we work with that are fresh out of school or who have been in practice for a while but still feel like they're struggling to grow their patient roster, they felt the same way. They felt like the investment was big. They felt like it was a big leap of faith in themselves, maybe a little bit in us. But what they found was that their ability to attract patients, their ability to show up as an authority in their community was really amplified by their experience in being in TCC. And the number of questions and vulnerable shares that we've seen in our community about growing practices and being business owners, that is worth the price of admission enough to know that you're not alone and you have an entire group of clinicians who want to support you. That premium membership is $13.97 for the year. And again, it gives you that 365 days worth of support, as well as unlimited support and access to all of our content over the next year. I would love to answer any questions that you have. I'm just going to glance at the chat and our group of individuals who are here. I know for some of you that you have had the chance to play around with the AI before. I did preload a few people's questions that had been pre-submitted. And so I just wanted to show you some of the examples that were felt sort of topical because they're questions that some of you and the audience have actually asked. So you can see, for example, it's giving you the studies and shown you exactly what to expect, right, in terms of reduction in blood work. And imagine again how confident you would feel if you said to your patient, this is what I expect to see in your blood work over the next 3 months. Or how confident you would feel talking to their doctor saying, we're going to give berberine a shot first. My expectation is it drops hemoglobin A1C by 0.5. Let's recheck in 3 months together, right? It's going to change the way you practice if you can show up at this level with your patients. This is another question that someone asked. I always love to highlight typos because one of the beautiful things about AI is that it knows what you're asking, even if you make a typo. So asking about how to use these ratios in order to assess insulin resistance, and it's giving you all the cutoffs, all the research, whether it's male, female, adult, child, it's giving you everything you need to feel confident about how to calculate that ratio for your patients. And then the last one that someone asked, nutritional deficiencies are affiliated with increased fibroids. Deetria, I think this was your question. And it gives you the exact answer on what to do for your patient and what to consider. It's talking specifically about vitamin D deficiency and fibroids. And it's funny, when I plugged this question in, I actually couldn't remember the answer. And then when it came up, I was like, oh yeah, I actually did this section for a Confident Clinician. And so you can see, right? These are real-time questions. These are questions you and your colleagues asked over the last week who were thinking about joining as members. And the research and the information is all there for you to elevate your standard of practice so that you can support your patients in the best way possible. I would love to answer any other live questions that you guys have in the chat. I'm happy to stay for a couple of extra minutes, but I hope that we've shown you today that you have access to something that's going to unlock potential in you like nothing else, right? Yes, you can do all those tasks on your own, but you don't have to. Right? You can, yes, you can write all your letters. Yes, you can save all your protocols somewhere. Yes, you can look at all of the new research on your own, but you don't have to. And we really were raised as naturopathic doctors that was your responsibility, right? That our medicine was so unique and so novel that there weren't these standards and there weren't these opportunities for us to build on the treatment plans of our peers. And that's actually not true, right? You have the capability and the access to get information from your peers, to pull information from the evidence, and for us to have that consensus-based prescribing as an entire profession. It elevates us all if we can work this way. Okay, great question in the chat. Can you ask about therapeutic doses for supplements as an example? Absolutely. So what's the right dose for saffron for ADHD? We'll ask that question. And so let's just see what is looking at here. I'll share my screen again. And I'll talk about how we built the database in a sec once I pull it up here. Okay. So here is an example, okay? So saffron has like a weight and age dose with respect to ADHD. And so I chose that one knowing that it was going to give us more than one answer. But if you ask any of these questions, it's going to give you the dose, the range, tell you where the evidence lies. We just did a great session on burnout and talked about ashwagandha, for example, and where the dose response curve is, where we actually see effect, why we disagree with one of the papers that says, X number of milligrams is accurate. And we actually changed our recommendations for our members based off of some research, but not all research. So great question in the chat about how do we build the content and where does this come from? So each medical module that we produce for you takes us about 40 to 50 hours of work. They're delivered in 2 90-minute sessions, and they typically have like somewhere around 150 to 250 references build each medical module. Completely depends on the topic, right? But quite often the reference list for each of the sections, which you have access to as a member, are about 150 to 250 references to build that module. We go through the positive literature, the negative literature, we go through everything. We show you everything from every end of the spectrum so that the answer that we give you is accurate. And we're also really clear about the limitations of the current literature. So here, this is a great example, right? While the results are promising, we need more information that compares it against methylphenidate, which would be your gold standard. We want to firmly establish optimal dose and long-term effects. It says this at the end of some of the recommendations because it has said that in somewhere in some guideline that is in the database as well. So we know that you're the healthcare provider, but it's acknowledging some of the limitations of the current research. So if you navigated to the ADHD section, it would provide you the videos, how we got the answer, right? So how did we get these answers, right? This is actually, you can actually hover over the source file and see where all of the information is on the main dashboard. All of the references, all of the standard of care guidelines that are available on the topic, the slide deck from the presenter, so that that information all gets synthesized when it brings you the answer. So we're not just picking any study. And this is one of the differences. You know, there are other options out there that will list study summaries and say creatine is great for depression. And it's like, well, compared to what? And when do I use it? And is it in everyone? And is that with medication or not with medication? We've given you the how. How do you do it? How do you put creatine in the treatment plan of someone with depression? When is it applicable? When isn't it? What's the dose? What do we expect? What's the magnitude of effect? Does it go with their medications or not? We build the how. It's not study summaries. It's a framework for how to work with this medical condition. And this topic was delivered by an expert in the field. So that's how we build the database, which is really unique. There are many other databases or search tools that are summarizing papers, but that still assumes that you're going to go back and read the full text and that you're really good at critical appraisal to know if the full text was accurate. And when you ask our content, it will actually tell you what we thought about the papers. We'll say, look, this was translated from another language. The translation's not perfect. There's a lot of typos in it, but here's what we think, right? We're able to actually give you that level of confidence and depth as we're building it. Great question about blending with EMRs. So the content is, you can capture it, right? You can like capture the text and add it to your EMR. So if you ask it to build a nutrition protocol, you can capture the bullets and paste it into your EMR. And so that would actually give you great option for reducing time spent for your patients, because you can say, can you give me recommendations for acne? And it will write them all down for you. And then you just paste them into your EMR. So that's one of the big time-saving techniques. Thanks for calling that out. And so the content gets updated often. So not every topic has a lot new to say every month, but we do have behind the scenes research teams that are scouring new literature to make sure that we are confident in the content that's been delivered. Not every paper that's published should change the way we practice medicine. And when I say that, everyone agrees, right? Not every paper should change the way that we practice medicine. The curiosity is which papers should change the way we practice medicine. And so our content does go through regular revisions. Sometimes it's a full revision where we address it as a full medical module with live classes and we reframe the entire content. Sometimes it's done as a mini update. We just did a mini update on cervical dysplasia, especially since the guidelines around HPV testing has changed in both countries, Canada and the US. Things get updated regularly. And then we also are always adding, expanding, and creating that cross connection between content. So when new information comes out about, say, asthma and HRT, it's creating a connection across multiple topics, and we build those connections for you so that you can see the interplay. I always say, like, if CE courses could talk to each other, right? How much greater would your learning up to this point have been? And this is exactly what our content does. It's continuing education, but your continuing education is now having a conversation with each other. And last year's continuing education is having a conversation with this year's continuing education. And that is the ability that we've built with our software actually allows you to build on knowledge over time and allows us to update you over time. When we make an update to the database, it's updated in the search tool within 1 second. And our development team asked me if I was okay with that. And I was like, what's the other option other than being updated every second? So you know and have confidence that if you miss a call, the content is uploaded there for you and you have access to be able to dialogue with it right away. These are great questions, guys, and I can tell that you're really close to believing that this could make a huge difference for you in your practice. And I would absolutely love to see you on that side of the membership, right? We do our best to share how transformative that experience can be. Now you have to trust in yourself that you are open and willing to transform with it in order to benefit from the amazing thing that we've built here at the Confident Clinician. So we've dropped the links in the chat there. Haley has given you access to the page to join the membership. I would love to see all of you on the other side of our membership so that we had a chance to get to know you as part of our community and support you over the next year in your practice. I hope you guys have an awesome rest of your day. And hopefully it's not filled with too many arrows that need to take up more time and you make it home for dinner. We will see all of you soon, I hope.